Hello guys, welcome back to the medicine revision series, the episode 13, and the topic I have chosen is pulmonary function test. Since we discussed COPD in the last episode, I thought to discuss a comparison between obstructive lung diseases and the restrictive lung diseases. So let's get started. So the question was a very straightforward question which came in Neet 2019, that is, on performing a pulmonary function test, reduction in FEV1 by FVC ratio is characteristic of restrictive disease, obstructive disease, normal lung function, and interstitial lung disease. So let us understand the pulmonary function tests in short and the comparison between obstructive and restrictive pattern, certain flow volume curves that can be asked as an image based question, and then we'll come back to this question. So before going into the pulmonary function test and the comparison, we should have a little idea about lung volumes and capacities. So first, the tidal volume, that is the normal volume of air which is going in and out in a normal respiration. Then the inspiratory reserve volume, that is the maximum amount of air which can be inspired after normal breath. Then expiratory reserve volume is the maximum amount of air that can be expelled out after a normal expiration. And the residual volume is the leftover volume in the lungs after the maximum air that can be expelled is expelled out. Then the lung capacities. So vital capacity is the IRV plus tidal volume plus the ERV. This is important. So functional residual capacity, so this term itself has residual in it, so residual volume has to be there. So it is residual volume plus the ERV, and the total lung capacity is the addition of all of the volumes. So I hope you have a brief idea about this. So the vital capacity is the one which we are measuring, and we are measuring it against a time. So we plot it in relation with the time. So when we plot it, the flow volume curve, this is how it looks. If you see, on one axis we put the volume, and on other axis we put the flow rate, and the inspiration and the expiration below and above respectively. And we always take a ratio between FEV1 by FVC, where FVC is forced vital capacity and FEV1 is forced expiratory volume at 1 second. And once we know both of the values, we take a ratio, and that helps us to decide whether it falls under obstructive pattern or a restrictive pattern. So for comparing between an obstructive and restrictive pattern, so in obstructive lung diseases, the problem is with the expiration initially, but later it recovers. So the forced vital capacity, that is the total capacity, is not affected, that is normal, but FEV1, that is the forced expiratory volume at the end of 1 second, that is reduced. So when we do a ratio, anything in the numerator, if it is going down and denominator is normal, the entire ratio goes down. So FEV1 by FVC ratio in obstructive pattern is reduced. However, in restrictive pattern, you can remember, like, everything goes down, everything is reduced, the entire lung volume is in fact reduced. So when a numerator and a denominator both is reducing, the ratio is generally normal. Hence, in restrictive pattern, FEV1 is to FVC ratio is normal, that is more than 70%. And in obstructive pattern, FEV1 is to FVC ratio is less than 70%, that is less than 0.7, which is necessary for diagnosis of obstructive lung diseases. Also, residual volume in obstructive diseases is normal or increased, but in restrictive diseases it is reduced. A little bit about the diffusion capacity, that is the DLCO. In obstructive diseases, it is reduced, particularly in emphysema, but in asthma, chronic bronchitis, it's normal. In restrictive diseases, it is reduced in parenchymal conditions, but it is normal in the chest wall or neuromuscular conditions. If you see the graph here, the red one is the normal lungs, yellow one is the restrictive disease where the entire volumes are reduced. So the graph is more or less same, but the height is reduced. And in the obstructive diseases, the main affected is FEV1. Later it compensates, so the forced vital capacity is normal. So the graph appears as such. One more image, this could be given in the exams, where normal you can see the green one. Yellow one is the restrictive pattern where the entire lung volume has come down. So you can see it is somewhere between 1 to 3, so that is just 2 liters. So if you see the obstructive pattern, there is generally a shift towards the left, and the pattern is a scooped out pattern. Again, this image is very important. Here, image A is the normal one. Image B, C and H is important, where B and C are the obstructive patterns. So in acute asthma and emphysema, both are obstructive lung diseases, you will get such pattern where there is a shift, and in emphysema you will get a very characteristic scooped out pattern as well. In fibrosis, that is a restrictive lung disease, the entire volume will be low, and you can easily identify the pattern. So coming back to the question, which was very straightforward. So on performing a pulmonary function test, reduction in FEV1 by FVC is a characteristic of. So we know the ratio is being reduced in which disease? It's reduced in obstructive pattern, where FEV1 is reduced but FVC is normal. Hence the ratio goes down. So the answer here is obstructive disease. In restrictive disease, both are going down, so the ratio will be normal. And in the interstitial lung disease, that is also a restrictive lung disease, the ratio will be normal. Hence the answer here is obstructive disease, where the FEV1 by FVC ratio is reduced. I hope you had a quick revision regarding the comparison between obstructive and the restrictive lung diseases, and this table is very important and you can keep a screenshot of this. Till then, keep studying, keep revising, and I'll see you in the next episode. Cheers.